What if I told you that a single phone call changed everything for me? My own mother, 72 years old at the time, called me from a clinic waiting room and said, "Clarence, they want to give me this vaccine, and I just want to check with you first." When she told me which one it was, I immediately said, "Mom, stand up, take your purse, and walk out of there right now. Do not let them give you that shot." She was confused. She replied, "But the nurse said it was recommended." And I said, "Recommended does not always mean it is right for you." That moment stayed with me because I realized something important. If my own mother, the mother of a doctor, almost received a vaccine that could have put her health at serious risk at her age, then how many other parents and grandparents are sitting in those same waiting rooms, rolling up their sleeves, trusting fully without asking even one question? And before you click away or assume where this video is going, let me clearly explain who I am and where I stand. My name is Dr. Clarence Martin. I am not anti-vaccine. I want that to be absolutely clear. I am not anti-vaccine. I have spent my career in medicine. I have given vaccines. I believe in the value of immunization. Vaccines have saved millions of lives throughout history, and they continue to do so. But here is what I also believe. Not every vaccine is suitable for every person at every age. And once you cross the age of 60, your body begins to follow a different set of rules. Your immune system is not the same as it was at 30 or even 50. Your organs process things differently. Your overall risk profile has changed. Some vaccines that are completely fine for younger people can become genuinely risky for someone in their 60s, 70s, or 80s. That is not fear-based thinking. That is simply medicine. That is science. That is paying attention. So today, I am going to walk you through 5 specific vaccines that I, as a physician and as a son, would never allow my own parents to receive after the age of 60. I encourage you to stay with me through the entire video because some of these may surprise you. Some of these are vaccines that are commonly offered to older adults in clinics and pharmacies across the country. By the end of this video, you will understand why I feel strongly about each one and what alternatives might be better suited for your parents or grandparents. And if you find this video useful, consider subscribing. Share it with someone who has aging parents. Share it with your mother. Share it with your father. This information could truly make a difference in someone's life. All right, let us begin with the first one. This is the one that almost affected my mother. The first vaccine I would never allow my parents to take after 60 is the live attenuated influenza vaccine. You may know it by its brand name, FluMist. It is the nasal spray version of the flu vaccine. Many people actually prefer it because there is no needle involved. You simply spray it into your nose and you are done. It sounds simple, painless, and convenient. But here's what most people do not realize. FluMist contains a live virus. Yes, it is weakened, it is attenuated, but it is still alive. For a young and healthy person with a strong immune system, that weakened virus usually causes no issue. The body recognizes it, learns from it, builds antibodies, and moves on. But for someone over 60, the situation is very different. In fact, the FDA already states that this vaccine is not approved for anyone over 49. Yet, I have seen it offered to older adults. I have heard cases from patients who were given it without being asked their age or without proper screening. For an older adult, a live virus, even a weakened one, can behave in unpredictable ways. The immune system at that age is already declining. This process is called immunosenescence. It means the body's defense system becomes slower, weaker, and less accurate. Introducing a live pathogen into that environment is like putting a weakened opponent into a boxing ring with someone who can barely defend themselves. It is not a balanced situation, and the outcome can turn negative very quickly. I have seen older patients develop prolonged flu-like symptoms after receiving the nasal spray vaccine. I have seen respiratory issues arise, and all of this was preventable because there are effective inactivated flu vaccines designed specifically for older adults. There is the high-dose flu vaccine. There is the adjuvanted flu vaccine, and these are designed to give an aging immune system the extra support it needs without the risk of introducing a live virus. So if your parent is over 60 and someone suggests the nasal spray flu vaccine, decline it. Request the high-dose or adjuvanted version instead. That is what I would choose for my own parents, and it is what I would advise for yours. Now let us move to the second vaccine, and this one may surprise some people. The second vaccine I would avoid for parents over 60 is the older shingles vaccine known as Zostavax. If you are watching this and your parent received a shingles vaccine years ago, especially before 2020, there is a possibility it was Zostavax. Here is the concern. Zostavax was also a live vaccine. It contained a weakened form of the varicella zoster virus, the same virus that causes chickenpox and can later reactivate as shingles. For many years, it was the only available option, so doctors used it because it was better than nothing. However, the limitations of Zostavax in older adults were notable. Its effectiveness dropped sharply in people over 70. Research showed that its efficacy in individuals over 80 was only about 18%. That level offers minimal protection. Because it was a live vaccine, it carried similar risks to those mentioned earlier with FluMist. In individuals with weakened immune systems, and many people over 60 fall into this category due to health conditions or medications, a live vaccine can potentially trigger the disease it is meant to prevent. There were documented cases of people developing shingles-like rashes and related complications after receiving Zostavax. Now, the positive update is that Zostavax has been discontinued in the United States and many other regions. It has been replaced by Shingrix, which is a recombinant non-live vaccine with significantly higher effectiveness. Shingrix shows over 90% efficacy even in adults over 70. It does not include a live virus and works through a completely different mechanism. It is one of the most effective vaccines developed for older adults. So if your parent has not yet received a shingles vaccine, ensure they get Shingrix rather than the older Zostavax. If they had Zostavax in the past, consult their doctor about getting Shingrix now, as the protection from the earlier vaccine has likely diminished over time. This is important because shingles is more than just a rash. It can lead to severe nerve pain that may last months or even years. It can also impact the eyes and result in vision loss. In older adults, it can be highly debilitating. So yes, vaccination is important, but choosing the correct one matters. Now, the third vaccine I would avoid for parents over 60 is the yellow fever vaccine. Some of you may be thinking this does not apply because your parents are not planning travel to high-risk regions. That is often true, as this vaccine is not part of routine care for most older adults. However, it becomes relevant due to increasing international travel among retirees. Many are visiting South America, Sub-Saharan Africa, and Southeast Asia, where the yellow fever vaccine may be required or strongly recommended. For example, a 70-year-old planning a trip to Brazil or Kenya may visit a travel clinic and be advised to take the yellow fever vaccine. The concern here is important. While the yellow fever vaccine is highly effective, it is also a live vaccine and carries one of the highest risk profiles for older adults. Health authorities, including the CDC, note that individuals over 60 have a significantly higher risk of serious adverse reactions. One of these risks is a condition known as yellow fever vaccine-associated viscerotropic disease. This occurs when the weakened virus in the vaccine spreads through the body and causes a severe systemic infection similar to actual yellow fever. It can affect major organs including the liver, kidneys, and cardiovascular system, and the mortality rate for this condition is very high. roughly 60% of those who develop it do not survive. To be fair, this outcome is rare. It does not occur in every older adult who receives the vaccine. However, the risk rises significantly with age, and it becomes even higher if the individual has underlying health issues, which is common in people over 60. So, what do I suggest? If your parent must travel to a yellow fever endemic region, have a serious discussion with their doctor about whether the vaccine risk is greater than the disease risk. In some cases, a medical exemption can be issued. In other situations, the trip itself may need to be reconsidered. Personally, I would rather my father skip a trip than take a vaccine with a documented age-related risk of a potentially fatal reaction. That is my perspective, both as a son and as a physician. The fourth vaccine on my list is the oral typhoid vaccine, commonly known by the brand name Vivotif. This typically comes up in travel medicine. If your parent plans to visit parts of South Asia, Africa, Central or South America, or other regions where typhoid fever is common, they may be offered this vaccine. There are two types available. One is the injectable version, which uses an inactivated form of the bacteria. The other is the oral version, Vivotif, which contains a live attenuated strain of Salmonella typhi. At this point, you may notice a pattern. The common factor here is live vaccines in older adults. I emphasize this because it matters. A live vaccine given to someone over 60 whose immune system may be weaker, who could be taking immunosuppressive medications for conditions like rheumatoid arthritis or inflammatory bowel disease, or who may have diabetes, heart disease, or kidney issues, can present added risk. The oral typhoid vaccine can lead to gastrointestinal side effects that tend to be more noticeable in older individuals. It may also interact with antibiotics and other medications that older adults often use. In addition, its effectiveness in older populations has not been studied as extensively as needed. The injectable typhoid vaccine, while not perfect, does not carry the same risks linked to a live organism. So if your parent requires protection against typhoid for travel, request the injection instead of the capsules. It is a simple adjustment that can improve safety. Also, have a broader discussion with their travel medicine provider about all recommended vaccines and whether each one truly fits their age and health condition. Avoid accepting a one-size-fits-all approach. Your parent deserves individualized medical care, especially when it involves what goes into their body. Now we come to the fifth and final vaccine on my list. I want to approach this carefully because it involves nuance. The fifth vaccine I would not allow my parents to take after 60 without thorough evaluation is the BCG vaccine. BCG stands for Bacillus Calmette-Guerin, and it is mainly used to protect against tuberculosis. In the United States and many Western countries, BCG is not part of routine vaccination schedules. However, in many parts of the world, it is given at birth or during childhood. There are situations where an older adult might still be considered for BCG. For example, if they plan to stay for a long period in a country with a high tuberculosis burden, or in rare cases where BCG is explored for other uses, such as bladder cancer treatment or research related to the aging immune system. The concern is that BCG is a live vaccine. It uses a live attenuated strain of Mycobacterium bovis. In older adults, especially those with any level of immune weakness, it can lead to serious complications. There have been documented cases of disseminated BCG infection, where the bacteria from the vaccine spread throughout the body. This situation is uncommon in young and otherwise healthy individuals, but it becomes a serious concern in older or immunocompromised patients. The symptoms may include ongoing fever, weight loss, and infections affecting multiple organ systems. Treatment usually requires several months of anti-tuberculosis medications, and these drugs can carry notable side effects, especially for aging kidneys and livers. So, in nearly every case I can think of, I would guide my parents away from BCG vaccination after the age of 60. If protection against tuberculosis is needed, there are other options. There are preventive medications, there are exposure reduction methods, there are practical ways to lower risk without introducing a live bacterium into an aging body. Now, I want to step back and explain why this topic matters to me personally and why it should matter to you as well. We are living in a time with a lot of noise around vaccines. Some people on one side claim all vaccines are harmful and no one should receive any. Others on the opposite side claim every vaccine is completely safe for everyone and should never be questioned. Both views are incorrect. The truth usually lies somewhere in between. Vaccines are one of the greatest achievements in modern medicine. That is clear. But like any medical treatment, they must be used with care, with context, and with attention to the individual patient. When the patient is over 60, the decision process changes. Everything I have discussed today comes down to one key principle. As we age, our immune system changes, and our medical care must change with it. What works for a 30-year-old does not always work for a 70-year-old. We owe it to our parents and grandparents to speak up for them, to ask questions for them, and to ensure they receive care that fits their situation. I also want to address something many of you may be feeling right now. Some of you may feel guilty because your parent already received one of these vaccines. Please do not feel that way. Medicine is always changing. What we knew 10 years ago is not what we know today. The fact that you are watching this video means you care. It shows you want to stay informed and do the right thing for the people you love. That is all any of us can do. We make the best choices with the knowledge we have at the time. Moving forward, you now have information that can help you have better discussions with your parents' doctors, and this is important. I am not telling you to refuse all vaccines for your parents. I am not telling you to distrust doctors. I am telling you to take an active role in their healthcare. Attend appointments when possible. Ask questions. If a vaccine is recommended, ask which product is being used. Ask whether it is a live vaccine or an inactivated one. Ask about specific risks based on age. Ask about alternatives. These are not inappropriate questions. These are exactly the kinds of questions good doctors welcome because they show involvement and concern for making the right choice. From my experience, the doctors and nurses who react negatively to questions are not the ones you want making decisions for your parents. A good physician will explain their reasoning clearly. They will review risks and benefits. They will respect your right to understand. If that does not happen, it may be time to consider another provider. Let me also talk briefly about vaccines I strongly recommend for people over 60 because I do not want this video to give the impression that older adults should avoid vaccines entirely. That is not true. The high-dose or adjuvanted flu vaccine each year is essential for older adults. Influenza causes tens of thousands of deaths among older adults every year, and the right vaccine can be life-saving. The recombinant shingles vaccine is highly effective, and I recommend it for every adult over 50. Pneumococcal vaccines, which protect against pneumonia and related infections, are extremely important for older individuals. Updated COVID vaccines are still advised for older and high-risk groups, and the Tdap booster, which protects against tetanus, diphtheria, and pertussis, remains important throughout life. These vaccines are safe and effective and are specifically designed or approved for older adults. They use inactivated or recombinant technology and have strong safety data in this age group. They also protect against diseases that affect older people more severely. So please ensure your parents are up to date. The message today is not to avoid vaccines. The message is to choose the right ones. I want to end on a personal note. My parents mean everything to me. They gave so much so I could become the doctor I am today. Every medical decision I help them make, I treat with full seriousness because sometimes their life depends on it. I approach your parents with that same respect. Every patient I have seen, I think about as I would my own family. What would I want for my mother in this case? What would I advise for my father? That is the perspective behind this video. These are not theoretical ideas. These are real conversations I have had with my own parents at our own table, and now I am sharing them with you. If this video helped you, if it gave you something to consider or encouraged you to speak with your parents or their doctor, then take a moment to like this video, subscribe to the channel, and most importantly, share it. Share it on Facebook where family members might see it. Send it to your siblings. Send it directly to your parents. Information like this can protect people, but only if it reaches them. You have the ability to make that happen. Thank you for watching. Thank you for trusting me with your time. I am Dr. Clarence Martin, and I will see you in the next video. Take care of yourself and take care of the people you love. They rely on you even if they never say it. I will see you next.